The RELENT research program is looking into the mechanisms of autoimmune disease and how to treat patients that suffer from autoimmunity better and more effectively. Autoimmune diseases are diseases in which the defense system of the body directs the immune response against the cells or the organs of the body. Particularly in RELENT, we are working on chronic autoimmune diseases like vasculitis, rheumatoid arthritis, or inflammatory bowel disease. Individually, autoimmune diseases are rare. Overall, we can say that on average, up to 8% of the population are affected by autoimmune diseases.
Some of the diseases can be mild, and some of them can be very, very severe. If you take a look at certain forms of vasculitis, the 5-year survival rate equals that of breast cancer. Your immune system gets overactive. It starts to attack your normal body tissue, which leads to inflammation. That results in pain, damaged tissue, and eventually probably organs which fail to function. We have to suppress that activity. And for that we use medication called immunosuppressors. And they're pretty serious drugs which have a lot of side effects and can cause other damage.
Because we have no way at present of predicting disease outcome over time, all patients tend to be treated in exactly the same way. One consequence of this is you tend to over-treat some patients, and in other individuals you under-treat them.
The main goal of the research project is to find ways to monitor the disease and treatment so that we can tailor the treatment to the needs of the individual patient to avoid overtreatment and undertreatment, extend the span without disease symptoms, and at the same time avoiding the side effects that come from overtreating the patients.
To meet this challenge, we have recruited from Europe and beyond the best clinicians and scientists and SMEs with the necessary and complementary skill sets that will allow us to achieve that vision. We are integrating various experimental data sets with detailed clinical follow-up data from patients with disease to identify specific biomarkers that can be used to predict and monitor disease course. In addition, we are also trying to get insight into the underlying pathological mechanisms which will enable us to identify novel targets for therapeutic intervention.
The RELENT project can really help us patients to minimize the risk of a relapse. And that is mainly because they look at different aspects of the disease. They look at the genetics, they look at how the immune system behaves, they look at how the immune system ages. So bringing that all together might lead to a completely different treatment, which is more personalized, safer, and leads to less side effects.